Well, the halls of science are filled with failed medical theories. Literally thousands and thousands of medical theories have failed the medical gang. And the newest failed medical theory is genetics. In March, I think it was March 22nd of 2013, Dr. James Watson, a PhD, he and his English cohort, Francis Crick, described in 53 the proposed description of the double helix as the structure for DNA. And 1962, they got the Nobel Prize for that, because everybody agreed to it by then. Of course, everybody was excited, and they have now identified the structure of DNA. And then in 2003, the human genome was published. And then 60 years from 1953, James Watson gave his speech in March of 2013. And he came out and said that all the experiments they've done in the last 60 years on genetics have been irrelevant. That's a pretty bold statement. And he said, you're not going to cure cancer, diabetes, or any other disease by sequencing genes. That the reason is these diseases are not genetic. It's all chemistry, biochemistry, a.k.a. nutrition. Well, you're living through the current failed medical theory that diseases are caused by genetics. This is a pretty bold statement. This is heavy stuff. You think about it. Back in the day, say 200 years ago, the medical thinking was that disease, particularly infectious diseases, were caused by spontaneous generation. They didn't know about germs and things like that. And when Louis Pasteur came up with a germ theory, because you actually see the bacteria that cause things like anthrax, and he had vaccines against rabies and everything. So he knew there was infectious organisms, so they called it the germ theory. And, of course, doctors still believed in spontaneous generation. And then more recently, there's the prion theory for mad cow disease and Creutzfeldt-Jacobs disease, a human version of it. It turns out that prions do not cause mad cow disease. You haven't heard anything about mad cow disease in the last couple of years. That's because it's a copper deficiency. It's not a disease of this protein crystal prions. It failed the Koch's postulate that you have to be able to transmit it, isolate it from one cow and give it to another, isolate it from a human being, give it to a chimpanzee. They've never been able to do that. That's because it's not genetically, or it's not transmitted by prions. It's a copper deficiency. We've actually known about that since the let me back up. We've known that since the 1860s, when a similar disease in sheep was found, and this disease was known to be a copper deficiency. Okay, it's kind of like the same disease as mad cow disease when you look at it under the microscope, and it's one of those crazy things that the doctors get off and running in one direction, and they spend billions of dollars, cost thousands of lives unnecessarily, and guess what? They're wrong on the genetics thing now. So, what's the new term? If it's not genetics, what is the term? Well, it's called epigenetics. And, of course, I have a new book out. This is very timely. It's a new book. We just happened to be writing this book when James Watson came out with his stuff. And it's called Epigenetics, the Death of the Genetic Theory of Disease Transmission. Epigenetics, EPI genetics, the death of the genetic theory of disease transmission. And the term epigenetics is actually a definition. It's a definition for nutritional deficiencies of DNA and genes that prevent the fulfillment of your genetic potential. In other words, birth defects are not caused by genetic problems. They're caused by nutritional deficiencies of the embryo. Okay. Cancer is caused by a combination of nutritional deficiencies, including antioxidants, to protect you against free radical damage and the consumption of large amounts of free radicals. You know, eating fried foods, eating burnt meats, eating processed meats with nitrates and nitrites, eating oils, oxidized oils in particular, all very bad stuff for you. But by avoiding the bad things and supplementing properly, taking in another thing called antioxidants to protect you from free radical damage, you can avoid cancer. And James Watson was pretty gutsy to be able to do that, okay, to say that. Well, in this book, Epigenetics, there's almost 700 pages of just the text. And this book goes into all the details of diseases that are thought to be genetic by the medical trade and show you very clearly that they are, in fact, caused by nutritional deficiencies. We're talking about Huntington's disease, which is held up as an iconic genetically transmitted disease. It's not. It's very closely related to Parkinson's disease and Lou Gehrig's disease, and even a little bit of Alzheimer's disease thrown in for Huntington's disease. And then there's cystic fibrosis, which, of course, I found the first non-human case of that in 1977 at Yerkes Primate Center and Emory University, and they fired me. They fired me because I said it wasn't genetic, that cystic fibrosis was, in fact, a disease of selenium deficiency. And then, of course, the Muscular Dystrophy Foundation fired Jerry Lewis because he took our data, showed the Muscular Dystrophy Foundation that muscular dystrophy is not genetically transmitted, that it is, in fact, caused by deficiency of selenium and some other things. And it's time that the medical system gives up this another failed theory. This goes into the halls of science as another failed medical theory, and you're living through it. So contact your Youngevity associate and get my new book out, Epigenetics. The subtitle is The Death of the Genetic Theory of Disease Transmission. Epigenetics, The Death of the Genetic Theory of Disease Transmission. You follow the principles in this book, and you'll add 25 to 50 healthy years to your life. That's pretty good. You'll add 25 to 50 healthy years to your life, and we'll be back. The dead doctors don't lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, if you recall, last week we started with this story from the AARP where the headline reads, 4 surgeries to avoid, and they're talking about getting stents in for stable angina, and then complex fusion, spinal fusion for spinal stenosis, as well as getting hysterectomies for uterine fibroids, and the fourth one is getting knee arthroscopy for osteoarthritis. So we got through the first one, and that was the angina one. Now we're going to head on to the spinal stenosis, and this is, of course, where you're getting back pain, and it's because the discs between your vertebrae have flattened out over time, and it's putting pressure on the spinal cord and the nerves, and you end up getting those pain sensations down your back and your arms and your neck, your shoulders and your legs. And according to Richard Deyo, medical doctor and professor of medicine at Oregon Health and Science University, says there's little consensus on how best to relieve back pain from stenosis, so doctors tend to develop their own preferences. And, of course, the top treatment of choice is this fusing, where they actually weld 2 or more of the vertebrae together to stop motion, and then that hence stops the pain. Well, according to him, he said that's the top treatment choice, and he recently studied the records of 30,000 Medicare patients who underwent surgery for stenosis in their lower back and found that the complex fusion procedures had increased 1,400% between 2002 and 2007. And, of course, he says the risks are significant, as those who underwent this complex fusion were 3 times more likely to suffer life-threatening complications than those who underwent less invasive surgery. Previous studies had also found that most of the fusion patients experienced no more relief from their chronic back pain than those who had physical and behavioral therapy. And there's even some evidence that this complex fusion surgery was worse than other surgeries. They say there are alternatives, though. They say before considering the back surgery, make sure you have exhausted the conservative measures, including physical therapy, cortisone injections, acupuncture, and medications. And he says, according to Arnold Weil, MD, and clinical assistant professor of rehabilitation medicine at Emory University School of Medicine in Atlanta, says that less than 5% of all back surgeries back pain requires surgery. And it's another interesting situation here, Doc, where, not one mention of possibly taking some nutrients to just rebuild those discs rather than cut them out or weld your back together or get, needles stuck in your spine and all kinds of other crazy stuff.
Well, you're exactly right, Doug. Once again, you get an A+ there. These doctors, of course, the surgeons are like carpenters. Everything looks like a nail, and they want to hit everything with a hammer. Surgeons only look at things surgically, and they forget that the bones that they weld together are going to continue to deteriorate as this person ages unless they change something. All these people with peripheral neuropathy, spinal stenosis, these peripheral neuropathies can include afibrillation, AFib, irritable bladder syndrome, restless leg syndrome. All of these things are caused by degenerative disc disease and squeezing of the roots of the spinal nerves. And here's where the Healthy Bone and Joint Pack actually can help. It'll support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. They can actually support the maintenance repair of those discs and make them thicker and juicier get the pressure off the roots of those nerves. I would certainly do that for 4 to 6 months before I would consider any surgery. Anybody who goes right for the surgery is being misled by the doctor so the doctor can get the money to put his kid in college. It's just really, really, really a criminal thing, and there should be legal consequences for these doctors that do these things because everybody knows they fail, particularly in older patients. You can't put a screw in a rotten, dry rot screen door and have it hold. Well, hang on, and we'll be back with more Troops and Dead Doctors Don't Lie after these messages.
Let's head to Massachusetts, and John, you're on with Dr. Wallach.
Hello, John, you're on the air.
Hello, Dr. Wallach. How are you?
Fine, sir. How can we help you?
I've called before, and I have ALS symptoms, and I'm on the protocol, and I have 3 questions I
yes,
have
sir.
on. Want me to say all the questions at once or one at a time?
Well, let's go one at a time.
I read in your book, Dead Doctors Don't Lie, that you should be concerned about your vitamin C intake with supplements with my health challenge. And when I take taking the tangerine, and I'm taking immortalium, and I'm also taking a daily. When I look at my daily dosage of vitamin C, I'm in the multi-thousands. Is that okay, or should I?
There's nothing wrong with that. When you're talking about even 10,000 milligrams of vitamin C a day is quite safe. Linus Pauling himself took that every day, and that's fine. That's not going to be a problem. Sure, it's going to have great antioxidant power.
Okay, even with the because your book said to watch out for that with my challenge. Don't you just avoid?
Yeah, that's fine.
The other thing is I'm not sleeping. I'm not sure if it's part of my health challenge. I haven't really set, honestly.
Okay, well, let's back up a little bit. Now, are you sleeping 3 hours a night, 4 hours a night, 2 hours a night?
All right, I don't want to sound strange, but I kind of go into a semi-sleep. I really don't go totally asleep, to be honest with you. I'm kind of going a quasi-sleep a little bit, here or there.
You take naps in the afternoon?
No. No, and I always used to sleep really good.
Okay. Actually, I find that people who use our program, who say to me, all my life I've slept 8 to 10 hours, and since I've been on your program, I only sleep 4 hours, and I roll around for 5 hours. And I said, well, why do you do that? Because the reason for sleep is to kind of rebuild yourself after a hard day's work the day before. And if you don't have any nutrients, it takes longer to rebuild yourself because your body's got to steal nutrients from your stored supply here and there in your body. So it might take you 8 to 10 hours to kind of rebuild from the day before. If you're taking the 90 cents of nutrients, it might only take you 4 or 5 hours. And an hour here, 2 hours there, an hour there, you're already at your 4 hours, and so you don't need much more to sleep than that. I sleep, on the average, 4 hours every night, and so I get to deal a lot with foreign countries over the phone and so forth because the different time zones and things. One day I'm in the Eastern time zone, the next day I'm in the Pacific time zone and so forth. And I only fully sleep, say, 4 hours a day. I'll get cat naps on the airplanes and things like that, and I'm quite functional with a reduced amount of sleep. Well, hang on, we'll get to your other 2 questions. And you sound pretty chipper for a guy that's not getting any sleep. And so I would challenge you to have somebody time exactly, either film yourself or whatever, find out how much time you are sleeping. And we'll be back after these messages. Okay, let's see, Doug, let's go right back to Massachusetts and John. If you want to try something for the sleep problem, in addition to the program you're already on, if I didn't suggest it to you, we do have an herbal combination called Sleep Ease, S-L-E-E-P, Sleep Ease, and it will actually help you become very drowsy and actually go into a deep sleep. So you want to take it about a half hour, take a couple of those capsules, maybe a half hour before bedtime with a glass of water, and you'll sleep very soundly. Okay, second question.
Just 2 quick questions. Next question is, I'm not sure if, I'm having all the eggs every day, and the biotin, I think it's appealing after I shower in the morning. Does that have anything to do with the eggs I'm having or the supplements?
Okay, I didn't catch you say your skin is peeling?
My fingertips, yeah. Oh, notice that, like I'm out of the shower, it's been peeling a lot lately. I wasn't sure if that had anything to do with having a lot of eggs every day or supplements.
Okay. And you are taking the supplements, correct?
Yes.
Okay. Are you taking de-stress capsules?
No.
Okay, well, I would add those. Add the de-stress. And I would go ahead and, what do you weigh, sir?
160?
160, okay. Go ahead and take 3 of those twice a day, and that'd be 2 bottles a month. If it's a financial thing, 1 bottle is better than nothing, and try 3. 1 at breakfast, 1 at lunch, 1 at dinner. Spread them out a little bit instead of taking them all at once. Okay, number 3.
And the last question is, and I asked you this last time, and I really didn't understand the answer, but I mentioned to you, there might be a relationship with my condition with mycoplasma infections, and I read something about getting on an antibiotic for 6 months, and you didn't seem like you liked that idea.
Yeah, well, mycoplasma is very typical of chronic respiratory stuff. It's also typical of rheumatoid arthritis, not ALS. Unless you also have rheumatoid arthritis. I mean, it's not unusual to have 2 or 3 diseases at the same time. People have arthritis and high blood pressure and diabetes at the same time. And so people shouldn't be surprised that they might have rheumatoid arthritis and ALS and maybe anemia at the same time. They're all kind of related one way or another, especially if you have a gluten intolerance. I don't know if you're on a gluten-free diet yet or not.
I'm on a gluten-free diet, but there's a professor named Professor Nicholson who's seems to see some type of correlation in people with this. That all seem to have some type of mycoplasma infection. They're not really definitive on exact relationship. And I wasn't sure, to go on it for 6 years. They recommend possibly. He's not my doctor.
I'd be amazed if it had anything to do. If the diagnosis is correct and it's a classic ALS, there's no mycoplasma infection. There's no infection involved. There's nothing, either lesion-wise, you can't see anything under the microscope in brains of people who have passed away to indicate there's any kind of infection. So I would think that that's like dealing with clogged arteries in your neck for Alzheimer's disease. It doesn't work. Okay, thank you so much. Give me a call every couple of weeks, John, and keep bringing me up to date, and we'll walk through this together. We'll be back after these minutes.
Let's head to Los Angeles, California, and Robert, you're on with Dr. Wallach.
Oh, Robert, you're on the air.
Hi, Dr. Wallach. I called last week about my dad, but I forgot to mention some of his eye problems. He has cataract on one eye, and on the other, and he has diabetic retinopathy on both eyes. And on the other eye, he has a detached retina. And I also wanted to ask about glaucoma for a relative, but that's pretty much my question.
Sure. Well, glaucoma is caused by PAD, peripheral artery disease, in the eye, and that's why the pressure goes up in the eye because the little arteries in the eye are kind of plugged, and the pressure will go up because the heart can't pump things efficiently through those arteries, so the pressure backs up. Diabetic neuropathies, of course, diabetic retinopathy is caused by high blood sugar, messing around with insulin, and all that kind of stuff. And then detached retina can be caused by a copper deficiency. Does your dad have gray hair?
Yes.
Okay, go along together. And also, cataracts are caused by free radical damage to the very sensitive proteins in the lens of the eye. So we're talking about fried foods, processed meats with nitrates, nitrites, things like deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, pastrami, that kind of stuff. And also gluten, got to get away from gluten, no wheat, barley, rye, or oats. It's just as important to stay away from the bad stuff as it is to deal with the problem and repair things. So, in addition to getting rid of all the bad stuff, and what does your dad weigh?
200 pounds.
Okay, 200 pounds. And all our programs are per body weight, so I'd have him take 2 of the healthy blood sugar packs per month. That will allow him to have a full dose of everything at breakfast, full dose of everything at dinner time, including the secret sauce for the diabetes, which is called the Sweeties. It'll be 3 capsules at breakfast, 3 at dinner. And what I want to do there is to take his fasting blood sugar every morning before he medicates himself, and as his blood sugar drops, take less and less medication. Now, specifically for the detached retina and the cataracts, if it's still early enough, you can only really support and promote maintenance repair of cataracts in the earliest of stages. And so I would have him take 3 selenium twice a day. 3 selenium twice a day. That would be 3 at breakfast, 3 at dinner time. That's 2 bottles a month. And not only is it for the selenium, it's a great antioxidant, but also for the copper that's in there to support and promote maintenance repair of the elastic fibers, which we want to be in place to help retain that detached retina and also stop the free radical damage to the eye. The glaucoma, I want him to add the Ultimate Daily tablets, 3 of those twice a day. It's 1 bottle a month, and they're designed to support and promote healthy blood flow through even obstructed arteries and also support and promote healthy blood pressure. So give us a call, I'd say every couple of weeks or every time your dad visits the eye doctor. If he has glaucoma, make sure that he stays on his drops. You only want to be able to reduce the pressure-reducing drops based on actual numbers taken by the doctor in the office. Okay, Doug, let's go to callers.
Let's head to Edmonton, Canada. And Brenda, you're on with Dr. Wallach.
Hello, Brenda, you're on the air.
Hi, Dr. Crick.
Hi, how may I help you?
Hi. Yeah, hi. Listen, I need some more help with my dear dad. He has a chronic cough, which is keeping him awake all night. He's very weak. He experiences shortness of breath and perspiration. The cough seems to be coming from the stomach area, so I was researching last night, and I think it may be GERD, but I don't know that for sure. There may be some post-nasal drip, and he may be aspirating some food or drink as well. He currently takes...
Is he laying down? Wait a minute. Is he laying down all the time? How come he's aspirating food and drink? That's pretty tough on the lungs.
When he's sitting up, he has difficulty swallowing.
Mm-hmm. Okay.
It's a swallowing issue.
Mm-hmm. All right. Does he have any diagnoses of anything like ALS or Lou Gehrig's disease, MS, Parkinson's, anything like that?
No, but there is a tremor in his hand.
Mm-hmm.
And so he is, my dad's 89 years old now.
Oh, congratulations. Okay,
well,
what does he weigh?
Yeah. My dad weighs about 140 pounds, and he's losing weight. And I currently, for the last couple of months, I've had him on 2 scoops of OsteoFX, 2 scoops of Tangy Tangerine, 4 selenium. Started him on 9 EFAs about 2 weeks ago. He was doing 6 prior to that. He's on glucogel for about 2 weeks, 15 per day, de-stress 5 per day, and ultimate enzymes 3 per day. He has, I took him off all his medication. He's also on sweeties. His sugars are, between 5 and 6, although they're elevated this morning. They're about 8.8 after fasting. He's on a gluten-free diet, and he's off all the 10 bad foods.
Excellent.
And so how do we treat these items? I guess the most absolute pressing right now is the shortness of breath because he's, having difficulty breathing.
Sure. Okay. Well, I would also get him the Oxybody. Get him the Oxybody, and that way it's going to, it's kind of a liquid oxygen supplement. And he can actually, I'd give him a half ounce of that 3 times a day, so he'll need a bottle and a half, essentially 2 bottles a month. The Oxybody tastes very good, and he could take a tablespoon 3 times a day, which would be an ounce and a half. And this is going to help raise, support the oxygen levels in the blood. It's going to give his lungs a little bit of a rest. And again, it's imperative that he stay away from anything that's inflammatory, which bothers the lungs. And reflux, I didn't catch it. Is he actually taking the ultimate enzymes?
Yeah, he takes the ultimate enzymes.
Okay, good. At his body weight, since he's 89 years old, I start him out, if you're not, 1 a day, before each meal, so it'd be 3 a day, it'd be 1 bottle a month of the ultimate enzymes, and say 2 to 5 minutes before each meal with a couple ounces of water. I want to reacidify the stomach. Don't let him drink any alkaline water and structured water. We sell those things. We love them very much, but not during meals, particularly when you have these kind of reflux stresses. You want to stay away from that, and because we want to acidify his stomach so he can absorb B12, so he can digest proteins, so he can absorb minerals, and also the stomach acid that's in the ultimate enzymes actually sterilizes the stomach and helps tamp down the population of yeast and bacteria, which ferment food coming into the stomach and actually generate gas, which causes heartburn and reflux. The old term acid reflux is quite incorrect. It really should be called lack of acid reflux. And so that, if he's not already using the ultimate enzymes, that's one thing I would add. And again, at 140 pounds, 89 years old, I would start him out with 2 to 5 minutes before each meal. 1 bottle a month should do that. And call me every couple of weeks. Let me know how he's doing. And we'll be back after these messages. We're back with Dead Doctors Online, the ZBS Radio Network. Dr. Joel Wallach here for Young Community, 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Kansas. And Janice, you're on with Dr. Wallach.
Oh, Janice, you're on the air.
Yes, hello.
Hi, how can we help you?
Well, I have been diagnosed last September that they said I had interstitial cystis.
Interstitial cystitis?
Yes, that's it. I don't know how to pronounce that for sure. And anyway, I've been taking DMSO treatments once a month, which has been helping it. But I have to keep going back all the time. I didn't know. I've been taking the Healthy Start Pack for 2.5 weeks. 8 days into it, I think it was a tangerine drink with all the extra acid in it that started me hurting and burning in my bladder area. I switched to the peach, and it's doing the same thing, but not quite as bad. Mm-hmm. Is there anything I can take to help me with that bladder
well, first
pain?
of all, how much do you weigh?
Okay, I weigh 205 pounds. Mm-hmm. I've lost 11 pounds since I've been on this 2.5 weeks on the starter pack.
Good. And how tall are you, ma'am?
I'm 5'5". Got lots to lose.
Okay. Well, first of all, interstitial cystitis is kind of like fibromyalgia of the urinary bladder muscles. Okay. And so I would kind of switch your program to being a little more tuned directly to fibromyalgia, lupus, that kind of stuff. And I would have you take what we'd call the Healthy Bone and Joint Pack. The Healthy Bone and Joint Pack. And the Healthy Bone and Joint Pack would allow you to have, I'd have you take 2 of those because it's 1 per 100 pounds of body weight, and that'll allow you to have 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that be accomplished by the 2 Healthy Bone and Joint Packs per month. I'd also have you take 3 selenium 3 times a day, 3 at breakfast, 3 at lunch, 3 at dinner. That'll be 3 bottles a month, and that is to support and promote maintenance repair of the smooth muscles in the urinary bladder. Also, I would have you take what we call the CM cream. You're going to get some CM cream with the 2 Healthy Bone and Joint Packs, and I want you to put that in your how would I say this? Just above your pubic bone, right? Just above your pelvis here. Put like half a tablespoon once a day, just above your pubic bone, right on your belly, and to do that maybe once or twice a day. And then it would also take the CM Plus capsules, the soft gel capsules, and take 3 of those twice a day. And that's going to give you internally anti-inflammatory relief. It's the CM Plus capsules. I would go ahead and, like I say, take 3 of those twice a day or three times a day, so it'll be 2 or 3 bottles a month. And orally, that's going to give you a systemic anti-inflammatory thing, and that should relieve you of that burning that you're having. Also, this program is going to help you with your back. Oftentimes, do you ever have a history of a back problem?
Yes, they said several years ago that I had a ruptured disc in my lower back.
Okay.
I refused surgery at that time.
Good.
And,
okay. Did they ever say you had UTIs, urinary tract infections, and gave you antibiotics?
Not that I know.
Okay, because a lot of times, particularly women, when they get burning on urination, doctors will say, even without culturing, they'll say, you got a UTI, you got a urinary tract infection, and they'll give you antibiotics. And I've had women who've had antibiotics for 10 years, and the burning never goes away with the antibiotics because it's not an infection. It's actually a back problem causing a peripheral neuropathy in the bladder. So that's a possibility, too. And the Healthy Bone and Joint Pack with a 15 glucogel a day will support and promote maintenance and repair of the disc between the vertebrae. And so call me every couple of weeks after you've added these things to your program, the CM Plus capsules and the CM cream that you're going to put just above your pubic bone. Well, thank you, Shar. I know Shar was holding on here, poised to jump in answer any questions, but we didn't have some that would fit her scenario there, so I apologize for having her on here, not sending the questions to her. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.